Great. How are you feeling?
I'm doing good. Glad to be here.
We're glad to have you.
I guess virtually.
Could you start us off with who you are and what you do?
Sure, yes. My name's Jami Gibson. I'm currently a nurse practitioner. My specialty is adult health. So I was certified in adult health, and I currently work at CareBridge Palliative Care. And I can go into more detail about palliative care now or later, just whatever you want me to do.
Um, yeah, you could touch on it now. Just go into a little bit of what you do and how.
Sure. So sometimes patients and families and people in the community can confuse palliative care with hospice care, and it's two different specialties. Palliative care is when a patient has a chronic or life-limiting illness, and they really want to address their symptoms related to that, and they could either be getting aggressive, they could still be getting aggressive care even with palliative care. And then, the symptoms that go along with disease process, a lot of times people think palliative care just sees cancer patients, but that's not true. We see cancer patients, but we also see patients that potentially could have heart failure or lung disease or neurologic disorders that have symptoms related to those disease processes, and we treat those symptoms as well. So palliative care is kind of this specialty that really hones in, works on patients' goals of care related to their disease process and also symptom management.
Okay, sounds great. Could you talk to us why you chose to go into nursing, specifically being a nurse practitioner when you know there's other healthcare fields like, doctors and PAs, etc.
Sure. Yeah, so this kind of goes all the way back to me being a kid. And honestly, my mom had a gallbladder surgery. And back then, the surgery was really invasive with a big, huge scar. It was a major surgery. Now it's laparoscopic, and usually it's a 1 day procedure. So, long story short, she was in the hospital, came home and start having complications. And then, as she started having complications, went back to the hospital. And it wasn't the doctors that figured out that she was having the complications and there was more issues. And what she ended up having was a pancreatitis. It was the nurses that figured out the symptoms that she was having and then reported that to the doctors. So that was my first light bulb that went off, that I want to be a nurse. And then that formulated later on into I want to be a nurse practitioner and be able to assess patients and work with their care plans and help them. So.
Okay, sounds great. Could you talk to us a little bit what a day in the life was like for you pre and now that we're in the pandemic?
Sure. So pre-pandemic, I was actually working in a different setting. I was actually at UC with the palliative care team there, and it was a lot of in the morning, kind of organizing our day to see what patients needed our services because it was a consult service, and different services throughout the day, asking us to come see patients that had chronic or life-limiting illnesses and going over their care plan with goals of care and then symptom management. As March hit, I was still there, March 2020, and it very dynamically changed the way that we worked. So a lot of the in-person goals of care conversations and a lot of the in-person symptom management changed to phone conversations or between a glass or between a door, seeing patients and trying to assess the things that they needed from palliative care standpoint. As I've gone out into the community to do palliative care, because that's what I do currently, you see patients in the home if it's a new visit or at a nursing facility, but you have the full PPE on, face shield, mask, gown, and you're going into rooms, seeing patients and doing the same thing with symptom management and making sure that you can be able to address their needs. And then we've also kind of swiftly gone to this telehealth system where we see people on a secure telehealth chat and address these symptoms through video, just very much like what we're doing right now, but more medical related and focusing in on what their symptoms are that way.
How a woman, specifically a Black woman, affected your experience being a nurse practitioner in palliative care?
I have kind of like one example, many examples, but one that really sticks out in my mind. I have worked at UC kind of through my career, and I know that sometimes there's kind of this bias that maybe African American and maybe African American women are in the health field, but maybe an aide or LPN. And I think I've gotten that several times. You don't look old enough to be a nurse practitioner. I've gotten quite really blank stares as I go into rooms and talk about a care plan, especially because I worked in oncology as well with patients. And kind of, are you my nurse practitioner? Are you the nurse? Just kind of asking. I've also had situations where I'm like with a social worker that would be of a different culture, and they look to that person for the answer instead of me, and I'm the medical provider. Those are kind of the experiences I feel like I've had with being an African American nurse practitioner. There's not many of us, but I think there is definitely some bias there when you go into a room and you're saying you're introducing yourself as the nurse practitioner, but then you get a little bit of pullback from a patient or the patient's family members about what your role is and how you support them through their care.
Okay, and so could you go into why you think why it is important to you to diversify the healthcare field?
Yeah, I think it's super important to be able to diversify it. I think that when you talk about the kind of history of healthcare itself and the Black community or African American community and some of the different things that have happened, there's a lot of mistrust where, the African American community sometimes doesn't even reach out to physicians because they don't trust that the care that they're going to get is adequate or the same as their counterparts. So, all in all, I think that, making sure that you have someone that looks like you in front of you that can provide adequate care sometimes helps break down the barrier of that fear or mistrust so that the person can get adequate health. I think that's a lot of times where health disparities come in. People don't have access, but then on top of access, there's this mistrust and this disbelief that the provider that they're going to see, if it's not an African American provider, someone that looks like them, is going to help them adequately or the right way.
Okay, thank you so much.
Mm-hmm.
Isabel has a question. If you want to unmute yourself and ask Isabel, or I could just ask, whatever, it's up to you.
Is it in the chat box? Do I need to be looking at that?
Yeah, it is in the chat.
Okay. What pathway did I take in my education? So my undergrad path was I went to Ursuline College in Pepper Pike, Ohio, which traditionally is a 4-year college institution. But it took me a little bit longer. I was there 6 years because I had to do some like pre-nursing classes and then transitioned into the nursing program. So that was my path. I did the undergraduate first. I worked for several years at TriHealth on a medical surgical floor, then transitioned to the ICU, and then decided I had shadowed a nurse practitioner at that point, and then decided that I wanted to be a nurse practitioner, so wanted to go back to school and applied at University of Cincinnati for the graduate program. And I'm currently in the DNP program at UC too. So go Bearcats. Hopefully that answers Isabel's question.
And there's another question from Abby. She wants to know what made you choose palliative care in specific. I think you touched on that a little bit earlier.
Yeah, so if I think about my career path as I became a nurse practitioner, my first job was at the Barrett Center, and I worked with mostly GI cancer patients. And a lot of those outcomes are not great. Like you can treat the patients with GI cancers, but a lot of them succumb to the disease, even if they're treated with chemotherapy or radiation treatments. And I felt like sometimes, we talked a lot about the treatment, but we didn't talk about the alternatives, right? And sometimes the patients didn't have or didn't feel like they had an option to really choose something else. They felt like they had to keep going with chemotherapy, or they had to keep going with, alternative treatments to try to see if this would work. And sometimes it got to a point where they kept starting to go in this cycle of repeating themselves, going back and forth to the hospital, and really ended up kind of their last days being in the hospital instead of maybe spending that with family. And I was like, there has to be a discipline that focuses on patients' goals and what they want, whether that be aggressive care, continuing on that continuum, or not. And when I start doing more research, that was palliative care. So that's what made me switch over, is that I wanted to focus on patients' goals and what they wanted. And in my experience, I love the fact that I can be able to talk to patients and families about if they truly want to continue this route or if they don't. And then collaborating with the physicians and other care providers to let them know this is what the patient and the family has expressed. And maybe they didn't have the voice to express it before, but I helped them transition that thought through me, and me be the advocate for them.
So with being a nurse practitioner, a lot of the rules are changing, but could you talk about how much freedom you have to, prescribe medication and take care of patients as a nurse practitioner?
Sure. So in Ohio, we're one of the states that is a little bit more lenient in prescriptive authority. And what I mean by that is that you usually have to have a collaborating physicians. I operate underneath my own licensure, and I have my own certification, and I'm able to write my own scripts. I have my own DEA number, my own, ways to be able to prescribe. But I usually collaborate with a physician if I'm starting a medication on a new patient, and that's part of our kind of our guidelines as a nurse practitioner. If you're starting a new narcotic medication, you have to focus your efforts on making sure you talk to your collaborating physician. When I'm talking about collaborating physician, this is the physician that whatever institution you work with, you work with them to make sure that you guys are on the same page about patients' care. So there are nurse practitioners in Ohio that work independently and don't have collaborating physicians, but they have usually businesses on their own that they have formulated to work independently. But all the jobs that I have had, I've had a collaborating physician and prescribe, the medications ongoing, and then get feedback or collaborate with that physician about any medicines I have questions about.
Last question I have, could you talk a little bit, or any advice you have for any students who are considering nursing or being a nurse practitioner or anything in the realm of nursing? What advice would you give to them?
I say get a mentor. I have had a couple different mentors, and it may sound silly, but really being able to even shadow. I have one student that's in school right now, and I talk to her, a couple times a month, and just be able to get some more insight on what the field is like, the good, the bad, the ugly, what to anticipate. There was things that I didn't know that I needed to do as a nurse practitioner that I didn't kind of learn in nurse practitioner school. We talked about it some, but just making sure that you get certain things signed off on, get your certifications done at a certain time, keeping track of your CEUs, which is your continuing education. So, my advice would be, one, get a mentor and make sure you have somebody that understands the field to see if that's what you truly want to do, and maybe shadow them. My other thing is, if you get into a program, make sure that you have someone that you can call and talk to and troubleshoot through your curriculum to get you to the end point to matriculate. Because some of these nursing courses can be extremely difficult, and sometimes the courses that you take in high school can be quite different than your undergraduate or graduate level courses. So just making sure that you stay on task and stay focused on your goal overall, and do checkpoints as you go through and say, am I on task? Is this still what I want to do? And make sure you're evaluating that as you go through your curriculum.
Thank you so much. There's another question in the chat. Kelly Keaton, She asked, would you say that UC has been helpful with helping you choose a career path and finding somewhere to find a job?
Um, as far as the graduate school, like when I became an MP, is that what they're asking? If that's what they're asking, um, I did most of my search for a job without the support of UC. Now, I think it was more of a networking situation. I had a fellow nurse that at the time was a nurse. She's a nurse practitioner. Actually, she has her doctoral degree that I had talked to and told her, I'm really trying to find a position. I don't know exactly what I want to do, but these are my ideas. And she led me down the path of getting my first job at the Barrett Center. So I think that sometimes it's more about your ability to kind of open your mouth and say, I need support with this, with maybe some of your other community nurse practitioners or nurse practitioners that you know, or nurses that you know, that might have an insight for a job. I haven't found that just applying for a job has always necessarily worked. I think you have to kind of know somebody to know somebody.
Okay, well, thank you so much for your time. And we appreciate you answering all of our questions. So in case any students want to, reach out to you or ask you any more questions that they didn't want to ask, could you drop, your email, your LinkedIn, Instagram, anything, any way that you're comfortable with students reaching out to you?
Sure. I'll drop it in the chat box.
Okay. Thank you.
All right. Thank you so much. Thanks for having me.
No problem.
All right. Thank you.